Welcome back to the Clinician Career Reboot Podcast. I am so glad you're here. In today's episode, I chat with Katie Blackburn, a doctor of physical therapy turned healthcare quality manager who shares her journey on how she left the bedside into how she moved into this impact-driven role. This was such a fun conversation for us, and I learned so much about Katie and her journey and what she does on a day-to-day basis. So thank you for tuning in, and I hope you enjoy the episode. Thank you so much for tuning in today. Today, I am joined by my next guest, Katie Blackburn. Thank you so much for being here, Katie.
Thank you. I'm excited.
Let's start by introducing yourself to the audience.
Well, like you said, my name is Katie Blackburn, and I am a physical therapist by background. Right out of school, I actually completed a residency up in Washington State. And I say that because I definitely think that really kind of laid the foundation for some things that came after. But ultimately, I practiced for about 10 years in inpatient rehab primarily at a facility that's attached to a large level 1 academic medical center. And then over the course of that time, I ended up just continually coming back to different quality projects and things like that. Helped start a neuro residency actually at our facility. Got involved with doing onsite accreditation for other PT residency programs. And then at some point, one of my managers said, you really should look into quality because it really seems like this is something that you have a passion for and that you're really good at. And that led me to complete my master's in healthcare safety and quality. And then I ended up shifting into what's a newly created role within our department, our quality manager for our rehab facility. And that's where I'm at today.
That's awesome. So I'm curious because a lot of therapists do not know anything about healthcare quality or that it's even an option. So you said that one of your leaders mentioned it to you. What was it? What was happening at that time that made him or her decide to talk to you about healthcare quality?
Yeah, so I would say our larger enterprise that we're a part of had for several years been putting a lot of resources and time and trying to build up their kind of quality department within the main hospital system. And so they actually had something called Quality Academy. And that was really the first thing that my manager suggested that I be a part of. It was just one semester certificate program, just to kind of do a crash course, if you will, into what quality is and methodology and all of that. And so that was the first thing that they had suggested. And this was kind of part of a bigger plan because this person knew that our department was going to be growing very soon and that there was going to be more leadership structure coming into play. And so I think, there had been some identification of people that maybe would be able to fill these roles. And so they were starting to build capacity for some of these new leadership roles that were coming into place. And I just, right place, right time. I happened to be in the department. This was absolutely something that I was incredibly passionate about, just didn't really have a name for it yet. And it was a huge light bulb moment. As soon as this person mentioned it, as soon as I started that program, like day one, 5 minutes in, I was like, this is what I've been looking for. Like, this is it. So, yeah.
I love that because when I talk to people, a lot of times they're afraid to talk to their leaders about what they're interested in. But there's a lot of times that there are roles or opportunities coming available that the manager maybe can't speak on yet, or they know something's coming down the line that they can help prepare you for.
Yeah.
And it sounds like that's what your leader did for you.
Yes, absolutely. And I appreciate that so much. And I will say that over the years, I had many conversations with this person about, things that I felt like areas I wanted to grow in, things that I was really enjoying because I, again, kind of had fallen into consistently being a part of projects and program development within the department. And so that had been a signal to this person that, maybe this is something to talk more about. And as honestly, as many different leadership roles started coming online, I would always go meet with my manager to say, okay, we've talked about this manager, or excuse me, this quality manager position, but let's talk about this other one here. Like, does this role meet my needs or does it not? And
Mm-hmm.
because there were other roles that were kind of coming online that I felt like I might be interested in. And so I really relied on this person to help me figure out, like, what would this role be? Does it meet my needs? You knowing that I have a real passion for quality, like, would I be the right fit for this other position? And ultimately, I ended up kind of waiting for this quality manager position to come along. And I'm so glad that I did, because I am so happy in this role. And I feel like I'm doing exactly what I want to be doing every day, which is a really cool feeling. But it was hard for me as somebody who's, I would say, a go-getter and was like ready to jump on whatever, like to continue advancing and to kind of pump the brakes to say, this isn't right, this isn't right, this isn't right. Let me wait for the right position. But I definitely did that in collaboration with leadership.
I love that you said that. So for the person who's listening who is nervous about talking to their leader about their goals and future career aspirations, even if it's not directly related to their current role, what would you tell them?
I would say that it's incredibly important to really reflect on what you really love to do. You know, for me, it came down to really thinking about when I was a part of certain projects or fulfilling certain roles, like, did those roles really bring me joy? Or was I doing it just to check a box, add to the list? What things was I really passionate about? And then really kind of taking that self-reflection to my leaders, and multiple leaders. It wasn't just one, but leaders within the department and outside of the department, to kind of help me get some outside perspective and just say, okay, this is what I'm thinking, but what are you seeing? And just use it. It's all data, right? Like, this is all just data to go back and kind of look at and go, okay, what moves do I want to try to make? But I would say talking with multiple leaders that you trust, or even just trusted mentors, which really kind of links me back to my background in residency. I had been trained in this, system of really structured mentorship and getting accustomed to kind of getting my thinking out loud, so that mentors could help me wade through what it was that I was really thinking or trying to get at. And so I tried to lean into that as I was exploring new options, just get my thinking out loud based off the reflections that I'd had, and then let them give me feedback on that.
So you said earlier that you got your master's in healthcare quality. A lot of people want to know, did you need that to get a quality role? Did you get it after the quality role? What would you say about your reasoning for getting that particular degree?
Yeah, so I would say in the institution that I'm at, that it was necessary. I don't think that they would have potentially hired someone that did not have that role, or that did not have that degree. But that was definitely something that they were looking for. And because there were, again, our leadership structure was really growing, they were putting many different new positions into place. And so having that was definitely something that they were looking at. Again, at the same time, I think they would still have considered people and potentially hired someone if they didn't have it. But my guess is that they probably would have encouraged me to get it. But at the same time, I don't think that that's always necessary. It just happens to be the culture of the facility that I'm at. Something that is required as a part of my role, it's actually written into the job description, is for me to get my CPHQ. And so that's something that I'm, kind of getting some experience these first couple of years in this role, will prepare for, and then take that within the next 2 years or so. So that is required.
Okay, so they'll kind of pay for or reimburse you to get that, or they just require it within a certain amount of time after you've accepted the role?
So that's the idea, is that because it's written into the job description that they will pay for it. Now, I haven't gotten to the point where I've seen that happen. So, I can't say for sure whether or not that's going to play out, but that is the idea, that they will pay for that.
So what do you do in your day-to-day? What does a typical day as a quality leader look like from a practical perspective? So if someone was saying, I think I might want to do quality, but I don't really know what that means, what do you do on a day-to-day?
Yeah. So I will say right now in my position, because it's brand new and the quality leader directly above me is also fairly new, she's only been in her role for a year and a half or so, that we're in the process of really establishing this department and establishing what is it that quality leaders do within kind of partnering with and collaborating with the operational leaders of our department. And one of the main things that we're focused on just at the moment is accreditation. So there's a particular accreditation for the type of facility that we're at that is nationally recognized and is a goal that our upper department leadership has had for many years. And so that's really the first thing on the list for us to do. And that entails kind of looking at the various standards for accreditation, going back and meeting with our operational leaders across the board. So for me, this is an interdisciplinary discussion because it's not just therapists that I'm working with. Mm-hmm. It's all of the providers and different clinicians and staff members within the whole facility, which is something that I actually really, really love. So I'm meeting with them on a regular basis to see where we are in relation to completing some of the standards that we have and trying to help do small projects or initiatives to make sure that we can indeed show compliance when the surveyors come in about 6-7 months or so. Ultimately, logistically, it looks like having a lot of different meetings with different providers and staff members and leaders to figure out what's going on and to help kind of move things forward if there are new processes that need to go in place or slight tweaks to processes that we already have. And then ultimately working on some larger projects as well that either are focused just for one particular group, so maybe just with therapy, or I'm also doing some projects that are for the entire facility. So I would say that what I'm doing right now kind of looks a little bit different than what I'll be doing probably a year and a half from now when things are a little bit more established. Because there's also a piece of looking at a lot of the data and metrics about how we're performing as a facility. And again, we're just trying to, at this point, to kind of get established to get this culture of looking at our numbers and really using those numbers to help us figure out how we're doing to then drive process improvement and quality improvement.
See, quality is such a slow and steady process. And for people like you and I assume that we're similar on this, who, like you said earlier, we're go-getters, we want things to be done in a certain timeline, it takes practice to step back and say, okay, this may not happen as quickly as I want because we're changing a culture.
Mm-hmm. Oh, yeah. Yeah. I can't tell you how many times, and I was having these conversations even before I took this role, many, many years before, honestly, because our department has been, I would say, in flux for many years because this transition to we're doubling in size, we're going to be putting in all this new structure has been happening for several years. And early on, when I was doing projects within our department, I was working with clinicians who had many more years of experience, and their advice was slow down, like manage your expectations. Things are not going to happen quickly. This is a large facility, just keep plugging away. And I was like, no, we're going to get it done right now. Like, I'm going to make it happen. And, as you can imagine, what ended up happening is I realized that my mentors were exactly right. And so I kind of took that, and as the next, kind of generation of therapists were coming into our department, I found myself telling them the same things of, manage your expectations. I know that we all want this to happen quickly, but there's just a certain amount of time that it takes, which for me as a therapist and a healthcare provider, I think is a really strong parallel with healing, right? Like everyone wants healing to happen immediately. Mm-hmm. It doesn't. It takes time. There's an element of time. And so that's kind of an analogy that I've always leaned into to say, we've just got to let some things take time. And if we can get people to keep joining in along the way, it will be much more successful. But it's also feels, for me, it feels very painful to have identified an issue and know some potential solutions, but to not be able to make that happen.
Yes.
That is so painful. That I understand the reaction to that.
Yeah. And one thing I explain to people is, the operational leaders that we work with have other priorities too that they're trying to manage. So when we come in with a quality initiative, they might agree with it, but they also have other things that they're working through on a day-to-day basis that we have to be mindful of.
Absolutely. Absolutely. And I think too, and I've had several discussions with fellow clinicians kind of before I took this role, but now after as well, of really trying to figure out, make sure that we're speaking the language of our upper leadership, because they are looking at different metrics and different things that we're probably not looking at as frontline staff members. But it does benefit us to understand what those things are and those maybe strategic initiatives that the whole facility has, to be able to make connections between what is it that I'm seeing when I work with my patients. How do I connect that with how this benefits our facility overall, and how these projects could potentially shift some of the numbers that our leaders are really engaged with. And now moving into this role, I feel like that's even more important, especially as we're really trying to get this culture set of consistently looking at our metrics and ongoing conversations about how's our performance as a facility looking. How can we start tying in these smaller projects and initiatives to those bigger initiatives? Because that makes a lot of sense to our upper leadership and our operational leaders who are responsible for certain metrics that they're being looked at for.
Yeah, that's a great point that you make. When you tie what you do into what the overarching goal is, it takes you a lot further in trying to make those connections and potentially getting that next role.
Right. Oh, absolutely. I think operational leaders really like to see that you're thinking beyond the role that you have and the perspective that you just have as a clinician. I think that that's something that operational leaders can really appreciate. If you're thinking broader than that, I can imagine that the reaction to that would be very positive.
Oh, 100%. This all sounds great, Brandy, but I need some customized help and a strategy for my career journey. If that's you, book a strategy call with me. I'd love to talk to you. Go to definingpointcc.com/strategy. The strategy call is a 45-minute coaching session designed to get to know you, your journey, and your goals, and create a personalized plan for you to follow. You'll receive a written step-by-step guide after the call. To book, go to definingpointcc.com/strategy. I'll also post the link in the show notes. So throughout your transition into this new role and going through the academy and making the decision that healthcare quality was something that you were interested in, what was your defining point?
Oh, man. I thought about this quite a lot, and I can't say that I can narrow it down to one point, but what I will say is I think there are a couple of key points along the way that really solidified that this was something I was very passionate about. Again, the first thing that I think was my experience in residency and the attitude that my mentors had with me of curiosity, of constant continuous improvement. And they were never using the words quality and quality improvement. That was not something that was on the radar at all. But now learning more about quality, I realized that even though they weren't using that terminology, they had embodied so many of the concepts that are key in quality, of asking questions, of being curious, of continuous improvement. And I think the second step in that was, myself, like many others, we went through COVID and we saw how challenging things got. I mean, healthcare is challenging in general, right? But then you have these circumstances that come along that really just turn up the pressure. And for us, it was COVID on top of, these major shifts and fluxes in our department. And I saw the struggle of leadership to try to do the right thing. But it was really, it's just hard. There are so many challenges to doing good quality improvement. And I felt how hard it was as a clinician to experience the challenge of that time and the challenge of working with some of our leaders in that time. And I really wanted to find a way to be a part of the solution of how do I help improve things? And the moment that I started in Quality Academy and they started talking about methodology, it all just fell into place. And I was like, oh, okay, there's a way to do this in a structured, methodological way that is more likely to get us the results that we want. Like, I am in. And it just kind of felt like things started falling into place. And then eventually I was able to actually move into this role.
A lot of quality leaders think in processes and think in steps. So it sounds like when you saw that was how healthcare quality worked, you were all in.
Yeah. It was a light bulb moment for sure. Literally 5 minutes in, I was like, this is the thing that I've been looking for. Because I've been kind of dabbling and trying many things over the years. I had helped teach in our DPT program. I had done a little bit of research, just a lot of different things, but nothing really got me going, like learning about quality and doing quality. It was just like, this is it. For me, it just felt, honestly, it feels exactly like treating patients, which I know sounds like a weird thing, but the thought process and the clinical decision-making that I use when I'm evaluating a patient and treating them and reassessing them is the same sort of clinical reasoning that I'm using now when I'm evaluating a process and we're trying to track change for a project and we're trying to figure out like what is the most evidence-based intervention for this improvement that we want to have. It just feels so similar that, it was for me a seamless transition from working with patients to doing this because my thought process and clinical reasoning just feels so similar.
So seeing everything that you've seen and all of your experiences in healthcare, and maybe even on the patient side, I don't know if you've ever been a patient in our system, but what do you think would help make healthcare safer for our patients and more sustainable for our colleagues?
Yeah, I think, and I felt this as a clinician, and I see this now as a quality leader, and especially, honestly, this is what I'm doing. When we talk about what am I doing day to day, this is what I'm trying to do day to day is help us work together as true teams, because it is so much easier said than done. It is so hard to maintain great communication systems, to lean on each other and the skills that we each have as providers coming to the table to serve patients. But I think if we can do that, number one, it gets better outcomes for patients because we're all working together. But two, I also think that it takes a lot of pressure off of me as an individual provider to feel like I've got to be the one that gets it done. If I can really learn to lean on my fellow colleagues and the strengths that they have or the piece of the puzzle that they are responsible for, and we can all hold each other accountable for our things, I think that can really take a lot of pressure off of us as providers too. So that's something that I feel very passionate about, trying to help continue to establish that culture within our department, because it's not that people don't want to work together as teams. There are so many processes and system issues that stand in the way of that, as a quality professional, as someone who works on process improvement, I'm really trying to find ways to help our systems support collaborative teams alongside the culture of collaborating and really trusting and leaning into our healthcare team members.
That is such a brilliant point because, like you said, it's easier said than done. But when there is an adverse outcome, a lot of times it comes back to that lack of communication. And on the outside looking in, it would be like, well, why didn't you just talk to each other? Why didn't the left hand doesn't know what the right hand is doing?
Right.
Which can be true, but it's so much more complex.
Yes.
And I think people realize.
Absolutely. And again, this is something I love about the kind of perspective of quality is that, yes, you've got people who make mistakes. You've got the random bad apples who are just bad actors in the whole system. But that is rare. In the grand scheme of things, that is rare. From a quality perspective, I'm really looking at what about the system set us up to do these things that led to a bad outcome. Because as a general rule, people are doing the best they can.
Yes.
And, I've been in a role where I am just running, literally running all day, every day, trying to see all my patients, trying to do the best that I can for them, trying to meet all the requirements of my role in the department. I mean, literally running. And, when our providers are in scenarios of stress like that, inevitably, you're going to make mistakes, especially if the processes and systems that support us are not really leading us to do things in the way that we maybe would optimally do them. So
absolutely, because if you don't even have time for a bathroom break, right, or to grab some lunch to get outside if the weather permits and all of that, then you're not going to be in an optimal state to best care for the patients that you're going to see next.
Absolutely. Absolutely. How could anyone show up day in and day out like that and not make mistakes and not at some point have to say, oh man, I know that I've thought this before. I know that I really need to do this intervention with this patient today, but I am literally too tired. I have had that thought in my mind many times on a Friday. I know that I need to get this patient up in a harness. So again, I work in rehab, so we're doing a lot of, gait training, and I know I need to get this person up, but man, I just don't think I can physically do it.
Exactly. And that puts you in a bad position for your own back, body mechanics, all of that. And it puts the patient in an unsafe position potentially. So I totally hear everything you're saying.
Yep. And I bet a lot of people out there are probably going, yep.
They're resonating with you for sure.
Yeah.
Well, any parting words for the audience?
I think my parting words would be, I think with quality, I was shocked. I am shocked. This is still current by how much working in quality and working on quality related process improvement projects feels exactly like treating patients. So for anyone out there who is considering shifting out of a clinical role, but maybe has some hesitancy in that, know that you're not alone. Because honestly, for me, again, I mentioned kind of reflecting with my leadership and having conversations about what the right moves for me would be. It took me a couple of years to wrap my mind around the idea of leaving patient care because I love treating patients. I love it. Even though it was exhausting and it was totally wearing me down, I love it. I got such a high from working with people and seeing their progress and being part of their journey of recovery that I really had to kind of wrestle with this hesitation for a couple of years. And getting into this role, many people have asked me, do you miss it? Do you miss it? And honestly, shockingly, my answer is no. Because I feel like I'm still serving patients and I still feel like I'm using so much of the same skill and the same thought process. But now I get to affect many, many, many more patients than I would have as an individual clinician. And I also get to help our providers, which for me is an equivalent passion. I am equally as passionate about helping the therapists and the physicians and the nurses and everyone making their lives easier as I am with making our patients' outcomes better, because I think these ideas are incredibly interconnected. So, for those who are concerned or worried about how they'll feel in a non-clinical role. I think if you can stay with your passion and really kind of work through finding roles that you are still very passionate about, I think that you can still be incredibly satisfied in those non-clinical roles.
Well, this has been such a delightful conversation for me, Katie, and it reminds me of how much I enjoy hearing journeys just like yours and just realizing how much similarities we have. Mm-hmm. Some of the things you said, it just resonated so deeply with me. And it is so similar to how I feel about healthcare and healthcare quality and being able to impact more patients than I could at the bedside. And I know people may wonder, if we preload these conversations, but I'm learning about Katie's journey real time. And so this is very delightful for me. But how can people connect with you, Katie?
So full disclosure, I'm a millennial, but I'm a little behind with the times. All I really have right now is email. So I am happy to share my email for anyone who would like to reach out. I am on a journey of trying to connect with others like you, Brandy, who are in quality roles, because this area is new to me and I don't even really fully understand what the breadth of quality is in the great wide world. So I would love to connect with people who are in that similar journey and who have experiences in quality. So I can definitely provide my email for people. Do you want me to say it here or just give it to you to post?
You can give it to me and I'll put it in the show notes for everyone.
Perfect. I will do that.
Awesome. Well, I so appreciate you for jumping on this call with me and for having a conversation, sharing your journey, and for being so transparent and vulnerable. Thank you, Katie.
Absolutely. Thank you for having me. I really enjoyed this.
Thanks for tuning in to today's episode. For more career transition goodness, check out the show notes section of the podcast. I'll share all the links you need to connect with me and find the resources that you need.